Hello, everyone. We're going to get started. Thank you for joining today's webinar, Peers, Partnerships, Empower a Person-Centered Approach to BC's Poisoning Epidemic. I'd like to begin by acknowledging that CMHA BC Division's office is located on the unceded, traditional, and ancestral territory of the Musqueam, Squamish, and Tsleil-Waututh nations. Now, before we launch into the content of today's webinar, I'd like to point out a few features of the technology we're using and quickly run through the agenda. First of all, there are two options for sound. You can listen with your computer's audio or dial in by telephone. If you find that you're having difficulties with one audio option, please consider switching to the other at any point during the broadcast. Second, we will be recording today's session and posting the video online at getloudbc.ca alongside a PDF copy of the PowerPoint slides. You also have the option to download the slides, as I've mentioned, during the broadcast and afterwards before closing the window. The file is located on the handout section of the panel to your right. Third, after the panel discussion, there'll be an opportunity for audience members to ask follow-up questions. Please type your questions into the questions section of your panel to the right. You can do so as soon as they occur to you. The sooner the better, as I'll collect questions throughout the webinar and read them out to presenters in the order I receive them during the Q&A period. If you would like to address your question to any one panelist in particular, please make a note of this in your submission. We'll try to get to as many of your questions as possible before the end of the webinar. So before I introduce the panel, I'd like to provide a bit of context for our discussion. As we all know, Canada is confronting an unprecedented public health crisis. The most recent statistics from the Public Health Agency of Canada indicate that from January to June 2018, as many as 2,066 people died from opioid poisoning. That's around 11 people per day. BC continues to have the highest number of suspected poisonings, with 754 deaths counted for that time period. The high rates of mortality have been attributed to fentanyl and fentanyl analogs that have become increasingly available illegally in Canada and are finding their way into other substances. Hence why the crisis is one of poisoning rather than simply overdose. There is an urgent need for policy that is grounded in the best available evidence, as well as a need for intersectoral collaboration to support the health and well-being of British Columbians who live with substance use and mental illness. Addressing such an urgent health and social issue will require sustained effort to destigmatize problematic substance use and scale up harm reduction, treatment, and health promotion measures while investing in wraparound services and peer-driven initiatives that support recovery. BC leads the country in innovative and evidence-based harm reduction and treatment programs, demonstrating success by empowering peers or people who use substances to partner on or lead initiatives that are accessible, accommodating, and relevant to the people who need them. There is strong evidence to suggest that peer partnerships at all levels of policy planning and program development engender better population health outcomes. We are very fortunate to have some of BC's leaders on the webinar today, who will share with us how they have confronted stigma and opposition to advocate for and implement harm reduction initiatives. I would now like to take a moment to introduce them. Sally Mckay is the Evaluation Consultant for Compassion, Inclusion and Engagement, a multi-agency project that strives for long-term sustainable service improvement by building capacity within the system for peer inclusion and engagement in Indigenous cultural safety. Working collaboratively with service users, service providers, and decision makers, Sally uses evaluation as a tool to inform and guide research and planning to improve health services and outcomes. Welcome, Sally. Mel MacDonald and Charlene Burmeister have spearheaded grassroots efforts in Quesnel, BC. Melanie is the Executive Director for Seasons House Emergency Shelter, where she works with staff, community stakeholders, and peers to build solutions where people are alive, valued, and free from systemic discrimination and societal stigma. Charlene is one of the peers who works alongside Mel with over 100 years of experience, 10 years of experience in peer engagement and leadership. She has held and continues to hold many roles that include Provincial Peer Coordinator for CIE, member of the Peer Engagement and Evaluation Project, and founder and president of the Coalition of Substance Users of the North. Welcome, Mel and Charlene. Paige Phillips is the Health Educator Coordinator at SOLID, an organization of current or former illicit drug users in Victoria, BC, that challenges systemic injustice by promoting practical harm reduction strategies. Paige organizes health education groups, delivers cultural safety training in hospital settings, contributes to research projects on topics such as drug checking, provides peer navigation, and co-facilitates Street College in partnership with Shane Calder from AIDS Vancouver Island. In the position of Coordinator of Client Education and Engagement, Shane organizes programming and events for clients of AIDS Vancouver's harm reduction services. Focused primarily on the production of solidarity and the end of the drug war, he works both locally and beyond to promote the inclusion of people who use drugs. Welcome, Paige and Shane. Now that we're all in the same virtual room together, let's start the panel discussion. Sally, can you begin by telling us a bit about the Compassion, Inclusion, and Engagement Project?
Sure, thank you very much, Amelia, and thank you for all the attendees for coming to this webinar today. So my name is Sally Mckay, as Amelia said. I'm the evaluator for the Compassion, Inclusion, and Engagement, or CIE project. And I've shared a couple of slides which you can see if you download the PowerPoint presentation, which might be helpful as I sort of move along. There's some information that you might want to look at a little bit later. So I just wanted to start with sort of defining a couple of terms that we at CIE use quite often, just so everybody's sort of having a same shared understanding of what we're talking about. So when we talk about peers, we're talking about people with lived and living experience of substance use. And when we talk about peer engagement, we're talking about peers being included in a meaningful dialogue about harm reduction planning and evaluation. So the CIE team has 6 core members. We've been working together since 2015 with very little change in our team makeup. The initiative started as a collaboration between the BC CDC, Centre for Disease Control, the BC Mental Health and Substance Use Services, and the First Nations Health Authority. And it came out of an identified need to address stigma that peers were experiencing when accessing harm reduction services across BC, and also to support more culturally safe ways of providing harm reduction. So CIE recognized early on that change and the work that needed to happen at the community level, because community members are the experts in their own context and in their own community. And so we've developed a process over 3 years that is focused around a collaborative dialogue between peers and service providers in mostly smaller rural or smaller urban communities in sort of rural areas of BC, so the north and the interior. So the process that we developed consists of 2 days of peer capacity building, 1 day working with service providers, and then culminates in a day of collaborative dialogue between peers and service providers. And we realized very early on that it was really important for us to spend at least 2 days with peers in order to create an equitable space when we went into dialogue together with service providers. And so we have worked with 15 communities across BC. There's a map in my slides that show you where some of those communities are. We're also now part of First Nation Health Authority's official opioid emergency response plan, and we've been working closely with the Provincial Opioid Emergency Response Center here in Vancouver. So I'll speak a little bit about the evaluation because that's sort of where I'm coming from, and the evaluation has informed a lot of the work of CIE because we're using a methodology that's deeply rooted in participatory methods, and it's called outcome mapping. So outcome mapping basically starts from the premise that your project or initiative can't really be you can't attribute any changes that come about in your work, which is generally sort of community development type work, to the project or the initiative. The change that come about is really due to the partners that you're working with in communities. And the project or initiative is merely there to provide resources, support, information, and opportunities to your partners that you're working with. So to that end, CIE has been, in all the communities that we've been working with across BC, engaging peers and service providers in a dialogue over 3 years of what would it look like to you, what would it mean to you to define success in terms of peer engagement, having peers meaningfully involved in conversations around harm reduction. So we have had 144 peers, 201 service providers, and 12 healthcare leaders across BC contribute to the work that we've been doing in terms of mapping out what it looks like to successfully enable peers to engage in the system. And we've realized, we sort of started with this understanding, but we didn't quite know how it worked. And we realized over 3 years that the work of supporting peer engagement is not a simple process. It's not a linear process. It's a very complex, it requires complex solutions, and we're working within changing and dynamic and emergent situations and systems. And we've identified 3 key areas that are necessary to support peer engagement here in BC. And those are capacity building, developing networks, and policies and practice, changes in policies and practices. So capacity building is speaking about peers and also speaking about building the capacity of service providers. So that sometimes is going right back to sort of providing harm reduction 101 type education to some service providers. Sometimes it's talking about things like trauma-informed practice or working to improve Indigenous cultural safety, and to build in ideas of equity into the way people who are working in these systems are thinking. Capacity building is also largely around, our focus now is largely around building capacity of peers to be able to engage in an equitable way in collaborative dialogues. And then developing networks, and again, that can be peer networks and it can also be service provider networks. So the function of networks would be to provide mentorship and support, to share resources and share learning. And that's also something that we're really actively involved in now, is really trying to find ways to support particularly peer networks across the province so that they can work to support each other and share resources and learning and peer-to-peer mentorship. And then the other crucial part, which is sometimes a little more challenging, to be honest, is to support and try and advocate for changes in policies and practices in the system. So we recognized fairly early on, and it was reinforced in many, many instances across the province, that if you don't have a supportive and enabling environment, that regardless of the capacity that's available, with some, champion service providers and peers in your community, that you're going to run into some challenges. And so you'll see in my slide presentation, if you're able to download it, that I've posted what peers have told us in these 3 areas are the most important things for them in terms of what would bring them success and how they would be able to fully participate. So for capacity building, they told us things like they wanted access to education and training opportunities. They wanted to understand the healthcare system. They wanted to learn how to move ideas into action. They wanted more skills in overdose prevention. They wanted to be invited to share their experiences at decision-making tables. They wanted to learn how to cope with trauma and triggers when they were in stressful situations. And they wanted to understand the impacts of colonization. And then they told us in terms of networks what successful and supportive networks would look like. They'd feel safe and supported. They'd have better relationships with service providers and with members of the broader community, as well as with peers in their own community and in other communities. They'd be present and engaged. They'd be accountable to each other. They'd be believing in themselves as peers, and they'd be building better relationships. And then in terms of policies and practices, the things that peers told us were important, were getting paid for their work was number 1, came up again and again. Being involved in public campaigns and in educating the public, being invited to decision-making tables again, having policies be updated to reflect the priorities of peers in their communities, and to have access to more safe spaces to use substances in their communities. Understanding peer engagement better from a peer perspective has led CIE to shift its planning and its focus quite a bit from the beginning. And so now, because of the work that we've been doing over the 3 years and because of what peers have told us, we've really been focusing our work more on building peer capacity to be able to do this work, and finding ways to connect peers across the province in a network that's supportive of the work that they're doing. So we've been working quite closely with some of the community action teams that are the part of the provincial overdose response. We've been invited to work with them to find ways to engage peers in their community planning work. And we're working continually to find new ways for peers to stay involved and for us to support them in ways that are responsive to the needs of their community. So thank you very much.
Thank you so much, Sally. Melanie, I'm going to turn it over to you. Can you describe what took place in Quesnel following the CIE dialogues and how you went about securing resources to support peer-led initiatives?
Yeah, so thanks everyone for having me. So at the end of our first session with CIE, service providers we were divided up into tables with peers, and we were told to come up with a project that we could work on together in the coming months. I was really fortunate to sit at a table with some really passionate and energized peers in our community. And the project that we had come up with, or they had come up with, was they wanted to start the CLEAN team. And that was in response to growing community concerns and animosity around sharps being found in parks and outside businesses, and kind of some uproar that was happening in the community at the time. And they wanted to make a difference. They wanted to hit the streets, build the CLEAN team, and start cleaning up the community. And so as a service provider, I committed to them that I would seek out funds to support them and pay them wages. The peers from the CLEAN team were incredibly dedicated. It was almost a year that they volunteered their time, and they were relentless. They were out there, you know, a few times a week doing this work, and relentless on knocking on my door and making sure, Mel, have you found us money yet? Can you pay us yet? And so they really held me accountable, which was really great. We were fortunate. We received money through the Community Action Initiative, through their open grants, and it was to fund a few things. So one of them was the CLEAN team. The Community Action Initiative helped us employ part-time 2 peers to officially pay them wages for the work that they were doing. Since then, with the CLEAN team, they've just had such success in our community and have made such an impact that we've entered new partnerships for the CLEAN team, where the City of Quesnel and Northern Health and BC Housing all contributed to our organization to hire 2 more peers. So we have 4 CLEAN team members now who are out there employed on a part-time basis and really committed to the work that they're doing in our community. So we're really excited about that. Our Community Action Initiative funding also funded a couple other projects that we had on the go. Well, not really projects, but they gave us funding for the Coalition of Substance Users of the North, CSUN. And there's a few of us service providers who are really dedicated to helping CSUN get off the ground and get going, and just helping to secure funds for them and host funds for them to do the work that they need to do in the community. And so the money we received through the Community Action Initiative for CSUN helped pay for some really important training that peers identified that they needed. Some of that was computer training. They did a 12-week computer training course at the college. There was more than just naloxone. MRT was brought into the community. There was a number of trainings that took place to help build capacity and provide support to people. And CSUN's just amazing. They organized with us in partnership for International Overdose Awareness Day, and they've taken on a number of things in the community, and they are just out there changing perceptions and drawing attention to this crisis that we're experiencing. And then the other piece that the Community Action Initiative funded for us was a community conference. Our organization was in the midst of a bit of a public uproar because we were embarking on building some new supportive housing in the community. And there was a lot of NIMBYism, a lot of negativity being thrown towards our organization and people who use substances and people who are mentally ill in the community. And it was a really, really ugly time for all of us. And so we took the opportunity to use some of that funding to host a 2-day conference. And our provincial allies rallied around us, and they all showed up for our 2 days. And we had it was called Building a Compassionate Approach, Substance Use, Harm Reduction, and the Public Health Emergency. And so in planning that conference, we were really dedicated to make sure that right through the planning, through to the implementation of our 2 days, that peers were involved the entire way. And so peers helped plan and helped implement our 2 days. And we worked really hard to make sure that their voices were heard throughout that process. We had over 200 attendees. And one of the things that was really cool about it was that we also had a peer room at our conference, and peers did take home naloxone training for service providers that wouldn't normally be engaged, and other community members. And they also worked really hard on a Peer Voices art project where they, because some peers stood up and spoke about their personal experiences at the conference, but others didn't feel safe to do that because we live in a really small community and there's, dual relationships with service providers. And so they didn't feel safe. So we wanted to find a way that we could have their voices out there too, and those messages out there. And so they did this beautiful art project where it was like a day in my life. And we had all these picture boards and amazing messages set up at our conference so that everyone could see and so that everyone was able to have a voice with that. So that is essentially the work that we've been doing. I just want to make a note too that we are working really hard to make sure that we have media involved in everything we're doing. We're making sure that our clean team is out there in the media and they're in the newspaper, and same with our CSUN work. And that's helping to change those perceptions and change some of those stereotypes that are so negative in our small rural community. And so I think that piece around education, using the media to our benefit, is a really important piece. That's it.
Thanks so much, Melanie. Charlene, did you want to share a bit about your experience taking on a provincial leadership role as a peer coordinator for CIE and founding the Coalition of Substance Users of the North?
Yeah, sure. So I took on the role with CIE, just understanding that there was much work to be done, and was really interested in building my own capacity and working within the systems that I was exposed to previous to CIE. I think CIE has been an amazing opportunity for me to connect with peers throughout the province, creating networks with peers that are working within other organizations. It's been a really great place for me to have opportunity to build my own capacity and have autonomy also in the work that I do, with many of the other tables that I sit at and other work that I do provincially as well. And I think through the work that I was doing with CIE and some of the work previous to that with BC CDC with the PEAK project, was I quickly recognized how There was so many amazing organizations like SOLID and VANDU and WARS and BC Yukon Drug War Survivors, and all of those organizations out there that were doing this really amazing work with like boots on the ground and advocacy and all the amazing things that they were doing. And I was like, there's nothing in the North. And it was like, just, this has to change. And how do we do that? So I just worked really hard to try to access a little bit of funding, got some of that from a local resource here in Quesnel, just a few $1,000s to start that. Brought some of the community members that I had a relationship with in the past and just started the organization kind of from the ground up. We've grown since then. We sit at local, provincial, and national levels. We're really committed to the work that we're doing. I think I've had an opportunity for some leadership in CSUN, having been engaged in this work a little bit longer than most of the others. I recognize through CIE, through my own community, and all of the work that I do that capacity building is a huge component of the work that we seem to quite often be missing. We're asking peers to sit at tables and working groups that don't quite have the capacity to be there, so there kind of falls into this, it can easily fall into like a tokenistic approach, sometimes a parental or a punitive approach to engaging peers. I think it's really important to note that in the community of Quesnel, we had amazing leaders like Mel herself, and we have a few other small handful, unfortunately a small handful, but a small handful of really amazing advocates and supporters who helped CSUN along the way, and just to continue that work and to engage with those that support the work that you're doing and the work that we support each other in the work that we're doing. And I think I've met and had the opportunity to network with really amazing people, Sally, of course, being one of them, all my other team with CIE, working with BCCDC. So I think it's really important to note that when you're engaging peers, it is, it's just a really great way to have like a best practices approach to engagement and really understanding how that work needs to be done without like tokenizing and also being parental. And then of course, you know, that punitive approach of you must remain abstinent or be abstinent to be involved in this work. It's kind of a little concerning for me when people are hired in roles with their lived experience with drug use and then are then fired for their experience with drug use. It's a little contradictory. It can happen. So I think, yeah, just reflecting back on CSUN was just, I recognized that there was such amazing work going on throughout the province and that we were nowhere near all of the wonderful work that was going on there, and that it was a starting point. I had to start and I had to get community members in the North engaged, and here we are. Yeah, so it's been really great.
Thanks, Charlene. Did you want to give us, you kind of touched on best practices already, but did you want to go into a bit more detail of what some best practice might be for building capacity and supporting peers to partner on harm reduction initiatives?
Well, I think first I would recommend that people access the best practices document, which I co-authored as well as many others, peers with lived experience, worked on that project through, it can be found on the Toward the Heart website. I think it's just a really great document for, I think we all have really good intentions when we engage in the work that we do, and sometimes we don't think about the negative consequences sometimes to how we engage with each other. And so it's a really great starting point to give you some food for thought. You know, there's just some really basic things that people don't necessarily think about until they start peer engagement. And once they've started peer engagement, you know, like how to best pay peers, how to engage peers effectively, and having equity and not so much, you know, equality, and the differences between what that looks like. And so there's a lot of great information that has been provided in that document, which was co-facilitated and created with people with lived experience. So it's really important to recognize that that document was supported by people with lived experience. And then there's, you know, multiple other documents that I recommend. The Nothing About Us Without Us, Purology, which is being revised as we speak. So look for that new one, but certainly you can reflect on the ones that are already available. And they're available through Katie, the Katie website, but also through BCCDC at the Toward the Heart website.
Thanks, Charlene. Paige, I'm going to turn the same question over to you. Did you have any suggestions for or recommendations for best practices for building capacity and supporting peers?
Well, I think that what we've seen down here in Victoria for the last few years is involving peers in the very beginning. So what was going on down here was that service providers were coming up with an idea, a plan, and they were involving peers, normally for a $10 stipend or a gift card, and saying, does this sound right? Does this look right? And the peer would take the card, nod, and leave. So that's how tokenism, that's a pretty good example of tokenism and how that would build over time. But what we've been finding over the last few years is if you involve peers at all levels who use substances or used, and you have them involved in the pre-planning and then all the way through, you're gonna get true voices. The person's going to be building their capacity and building it quickly. So we've seen that, I mean, like, in Victoria, it's evolved like at an overwhelming level almost. Just everyone wants to be involved because it's more than just saying you're heard. You're actually being heard at all levels of the table. So I would recommend that. And I guess what I've learned personally, a good example is through research, being a research assistant. We had always been paid $10 an hour to participate in various forms of research that we publish here in BC. So in the last few years, what we decided with our partners down here was that we wanted to be trained to be actual research assistants. We wanted the very beginning, so we would learn all of the modules, we learn how to sit in meetings, what's expected of us, and through that, we get the same pay as university students. So now we make $25 an hour, the same as them, because the info we're giving is the same, and the level at the table is the same. Yes, I might be on the nod, or I might not be as coherent as you would like, but the answers that I give every single time are right on par. And so it's just making room at the table for that and allowing peers to have that ability and experience.
Thanks, Paige. Did you also want to take a moment to tell us a bit more about SOLID as a peer-led organization?
Sure. So we started in about 2001, and we started doing reg dig, needle cleanup, and that's primarily what we were known for around the city. When the opioid crisis started, we had a giant box of Narcan delivered at our door, at our actual house door, and they said, we need 24-hour teams to go deliver Narcan, train everyone you can, get as many boots on the ground. So we did that. It went for a few days, and then we opened up our first OPS. And the place that we opened it, at our Place Society, originally we weren't allowed to hand out crack pipes, harm reduction supplies. If we were found in our backpack trying to get needles for people, we would get kicked out. Now we're running an overdose prevention site in there. So that was a huge step for SOLID, and so we built our best practices, our hiring and firing, fitness for duty. So we found that quite effective for building capacity with our peers, and for service providers learning how to work with us and what boundaries that we do have. SOLID's mission, like what we stand for, would be empathy, compassion, support, harm reduction, education, and acceptance. So acceptance on all levels, whether that be like everyone's at different levels. Treatment, abstinence, harm reduction. It's meeting people where they're at and where they need to be. So equity-minded employment practices, that was a really big one for us. Shane's laughing because we got put through the ringer. Because why are you paying those junkies the same amount as our employees? They live in our SROs. They're homeless. What are you doing? You know, and we were getting that constantly at all levels, in housing centers, in the OPS, on street outreach. And so we really had to show our capacities on multiple levels, and then implement that and keep, keeping our partners on par with us so that when we have something to say, it's heard and then supported. And we've had a lot of success with that. So we find some of our workers make more than the straight people. Some of them make more than the university students. And it creates a lot of friction sometimes, but it also creates communication. And that communication has been so beneficial in building and keeping relationships and just so many different organizations. Okay, and an example, I would say, I'm going to talk about Street College for a minute, about support, education, and advocacy, respect. I mean, that's what we stand for. And Street College are people at all different levels. About 10 people who meet, they're either currently using drugs, or they have used drugs, or they're homeless. So we sit at the table, and we're actually, it's peer led. We decide what we're going to talk about. We decide what's going on in the community, and we decide how we're going to tackle that. And we use our peer partners, our service providers, who've over time built a relationship to trust and respect us, which is something that we don't. It's normally lip service that we get. But we have true listening, true respect, so the things and initiatives that we actually want to do, we're able to fulfill. Like coming up with SCS guidelines, like starting the OPS, like having harm reduction workers out there, having pay equity, not getting a $10 gift card for spilling our guts and our entire information about our drug use. We're getting paid the same amount, the amount that we should be paid for the information and what we bring to the table. So I would definitely say Street College is a big part of that in building everyone's personal capacity at their level.
Thanks so much. Shane, did you want to add a little bit about how the partnership arose between AIDS Vancouver Island and SOLID and kind of the genesis of Street College?
That is a tale. I just wanted to I just wanted to pick up on something that you had said around the having to prove when it came to the pay equity. It seemed like you had to work double time to get that respect, and I don't have to work that hard. I don't have to work that hard anywhere except at SOLID, right? When it comes to actually working with peers in the way that you described, I actually have to kind of make up for all the other people behind me who lip service and weren't, you know what I mean? So there's a lot of personal, I think if you're a non-peer and willing to really engage, there's a lot of personal growth in it, there has been for me, anyways, blah, blah. So Street College, so how do I say this? So SOLID, when I first got to AVI, my job was so we were about to be evicted. So the needle exchange was about to be evicted from AIDS Vancouver Island. Tremendous amount of NIMBYism. I mean, our neighbors were lawyers. They hated us. We were out, right? And so I was asked to do two things. One was to create a peer advisory panel group at AVI to try and get that group to kind of get a grip on the mess. And the first thing that they were to do was to create a code of conduct for the people who were using the needle exchange. And you can imagine how that went over. And so myself and my colleague Heather Hobbs were charged with doing this. So it wasn't hard to figure out who in the crowd were the leaders. So we say, look, can we pay you a lot of money to come to a meeting? And didn't tell them why. And then when folks got there, we're like, look, we've been asked to ask you to not only create this code of conduct so we don't get evicted, but also to try and enforce it with the community. And they were like, no. No way are we going to do that. So we asked, well, what do you want to do, right? Like, and so we just kind of kept doing that, and we've just been kind of doing that since, frankly, right? Like, with a lot of bumps along the way and a lot of like having to take my university brain out and put a different kind of thinking in there, and respecting, honoring what I'm being taught. Like I have a social work degree, but that means nothing really. That means almost like that means that I can walk into a situation and not be questioned, right? Like, whereas the learning and the relationships that I'm built we have been both life-changing and have been effective in terms of creating a bit of a political pushback against what is, you know, the town of the newlywed and nearly dead, as they say, right? Where there is nothing nice. Like people it's been a decade of having to push back. And so Street College is a place where we kind of have created a number of different, say, levels, but different sort of opportunities where people can kind of be involved, right? Like, so one is just like, show up, nod off, whatever, thanks for coming. It's all good. And then all the way up to like just having like the pen of like the leaders being like, oh my God, my week, holy smokes, right? Like, and have that peer support, and then figure out what we think we should do. Like look at the problems of the day and create a project. And then my job is to then take some of that administrative work, go and make something, come back and say, is this what you meant? And then do that 100 times. And then we have something that we can kind of, you know what I mean? Like kind of go with, right? Like, and we've created some awesome stuff over the years, right? Like, so much so that we,
like nothing about us without us.
Yeah.
Good example.
Yeah, nothing about us without us. Like,
I love that one.
I love it. You know, we've done the dope guide. Yeah. We do, so we do this so that, you know how your health authority puts out these like ridiculous like alerts for drugs? They're like, bad, hard drugs, you know, it's on yellow paper, and they're like, warning, it's an advertisement. That's all it is, right? Like, and they argue about what color paper and all that crap, right? Like, so we got frustrated at that and decided to make our own, like, kind of a what's hot, what's not in the drug scene that week. So we have, and like, the leadership made all the questions you'd have to ask and what it would look like, and I've never learned so much in my life. And I went, and so I just sort of, we did that back and forth for a while, and now we produce a weekly, it's called the Dope Guide, and it just is like, you know, this drug looks like this, when you burn it, it turns into this color, it smells like this, it's super strong, be really careful, or this dope is really shitty, don't even waste your money on it, like that kind of stuff, right? So those kind of projects where we'll just like, you know, like, and that's not a flagship project, that's just something we decided to do because it, you know, was good to do, right? Like, we do a yearly convergence for people who use drugs, which is just like, it's like a yearly democratic engine. You have to have democratic, just like what you're doing in the North with the coalition, right? Like a democratic engine. Some place where people can come together, be paid like they're master's students because they're at a master's level, right? Paid well, food, always have food, always have, and plenty of it. You're a dwarf going to the Hobbit's house, like lots of food, right? Like, and so we need to have those spaces where there is a democratic ability for people like me to sit there, take the notes, get the stuff, make sure there's bus tickets, and be directed, right, to do the things, and then come back and ask if you got it right. Always ask if you got it right, because I made that mistake many times, where I'm like, oh, great, oh, that's fine, I think I know, and I do it, and they're like, fuck, dude, we didn't say that. We said, you know, and so it's you ask, right? And so we went to Nanaimos recently. Yeah, do you want to talk about that?
Yeah, well, one of the things in our last Street College that came up was that we really wanted to support our peers in Nanaimo a lot, because it's really close city to us, so a lot of our family members and friends are just up the road. And what we were hearing from them is they had no Narcan training, and they did this harm reduction. Most of them didn't even know what the word was. So our Street College crew really wanted to focus our time, money, and energy. We did a double group that time, like 2 sessions in a row, to go out. It's kind of funny. We went with a big van of solid drug users, and we went up to Nanaimo, and we just went to their one little tiny drug using street where they have like a methadone clinic, and we had flyers, and we gave them to every single drug user we could find anywhere, parks, ABI, clinics, anywhere we could find them. We blitzed it. We had a meeting later that night, and we had a boatload of people show up. And we asked them, what do you want? How can we help you? This is what we're doing in Victoria. What do you need? And like what happened was in this picture, and I guess like we're just so proud of it because there's so many like different walks of life and so many there's so much ability to build capacity. Yeah. And you can see that now how Nanaimo's grown and how what they've been able to take back and the relationships that they've been able to build. They've had a hard time, like you guys up north, with awful. Yeah. But like we're able to support them whichever way we can, and we try to do that. And I think it's a really good example of building capacity because the leaders they have out there and the potential and what they want to, they're ready, and so we're ready to help support them.
So like my job was to get the bus, get the food, get the money, take notes.
And he did very well.
That's it, right? Like, and then like supporting, right? Like I think I'm talking too much. I'm gonna stop now. I'm gonna stop now. I'm done.
No, it's great. I feel like everything you're sharing is exactly what I think we're interested in hearing about. So you've talked a lot about your role in kind of supporting peers. Did you want to expand on that a bit more and talk about why organizations should partner with local peer groups rather than recruit a single peer or committee of peers just to consult on a program or a service?
Yeah, that is a very central feature to why we decided very early to reach out to SOLID. Like a decade ago, why we decided to reach out to SOLID and not form our own group, because that's was popular then and is still popular now. And the idea was ABI felt like, and this is under pressure from the health authority, is you need to have your own, how to say this, there is an air of legitimacy to funders if you have your own body, right? But if the group that you make has no actual democratic control over resources, staffing, like operations, any of that stuff, then it's just window service. Like it is just dressing, right? And so we, my colleague Heather Hobbs and I, made a decision to push back on like at ABI for that and say, no, what we need to be doing is investing into SOLID, because at that point SOLID's budget was like tiny, like it was like
a tenth of what it is now.
And now it's like it's almost the same as ours, right? Like it is. And so there was like, and Victoria wasn't the downtown east side, like who had decades of activist experience, like just like there was one Vendu, right? They weren't all over the place, whereas now I think BC has lots of peer groups. Like they just keep growing and growing, and I think it's really critical that unless you can actually share power, don't take it. don't even try, right? Like, so maybe you are lucky enough to live in a place that has a group like SOLID, and that worked out well for us. If you aren't, then what Cornell is doing, right? So our job then, like Mel, is to like get the money and put the money in and show up, right? Like, and so there is we need to be creating dual power, right? Dual democratic power, that those engines are, like every political movement has people who are not centered, who are critical to its success, right? Like this is not about me, but I can help. Like, I know I can be helpful, right? Like, so, and if I have to ask, right, how that's going to go, but, right? But does that make sense?
Yeah.
Okay, yeah, that.
Okay, great. Thanks, Shane. I'm going to turn it over to Mel and Charlene. Do you want to talk a bit about your partnership as well and how you've seen the dynamic between service user and service provider shift over time?
So I'll speak first. Because Charlene and I had this conversation prior to this, obviously, because we're both answering this question. And so I'll speak on behalf of our organization. And I think for years we've done a good job of hearing the voices of the people that we're working with and the people that we're serving, and responding to needs and seeing them as experts. I mean, years before we ever received funding, we would bring, we brought Shar and another peer in to train our staff when we started carrying harm reduction supplies, right? It was like, well, what is this? What are we doing with it? Like, what do people do with this? And it's like, well, who can we get to train us? Well, let's go to the experts, right? So I think we embarked on that years ago, but I think that over the last couple of years, we've solidified it quite a bit, and we've upped the ante with it. And I mean, that's partially due to the fact that now paying peers is kind of the flavor of the day, and we've received funding for it. And so we're able to engage in a much more meaningful and respectful way, right, as equals. And so that's really important. So I think for our organization, we've embarked on not just these initiatives I talked about today, but a number of other things that we've done that we've been able to increase that work and expand on it in our community. We love the people that we work with on a daily basis, and we live in this small community, I think, where it's just like Redneckville, and people are so ostracized and discriminated against and treated so poorly out in community and through social media and and at different levels through our municipality and different statements coming out from. Anyway, I won't go down that.
I might go down that.
But I want to say that, so for us, it's changed because it's given us, the funding has given us the ability to engage on a different level. It's given us the ability to host funds so that we can invest in peers, and peers get to say, well, we need this training, and we're able to go, okay, we can help with that, right? So I feel like it's definitely upped our relationship. We've been able to change as an organization. We've changed policies and procedures for engaging people with lived experience and living experience. So that's my perception from our organization. I know for myself that any table I'm sitting at, I'm inviting people to the table to join us so that those voices are at the table. And I'm constantly advocating at a different level. And I'm sitting at the table with municipal leaders or healthcare leaders or other organizations. I'm advocating, saying, well, where are our peers here, right? And we need them at the table too. However, I think that we've been successful at getting peers to the table at different levels in the community, but I'll let Charlene speak to that, because I don't know that people feel like their voices are really being heard and respected.
Yeah, could I just ask you to ask the question one more time?
Yes. So we're looking to learn a little bit about how the service provider, service user relationship has changed over time. in your partnership with Mel?
So I think it's important to recognize that I started working here within the Mel's organization at Seasons House here, Quesnel Shelter and Support Society, in 2010 when I first started my work as a research assistant with UNBC and some really amazing women in my community, Dr. Heather Peters and Kathy Rath, who took a chance, rolled the dice and took a chance on me as the peer leader for that project, which was the first time research around illicit substance use was ever conducted in a rural community. And so that's really how I got started in 2010. And then I came on as an on-call position and then worked my way through Seasons House to become a permanent full-time. And Mel and I have had a relationship for many years now, so 9 years. And she's been supportive in every possible way since the beginning of time, whether, before I even became an advocate in the work that I'm doing. So I think those relationships and those supports that I had in the community were integral to me to be able to stand and strong and do the work that I continue to do in my community. CSUN is like in its infancy, really. We've been around for 2 years, but it's really slow going when there's not a lot of other people who've been doing this work for some time to support moving things forward. We're building capacity slowly as we go, but I think it's important to recognize that there are a few people that are as amazing as Mel, like Kathy Rath, Heather Peters, and others in the community. Some I haven't mentioned, they know who they are. And without those people, we probably would not have gotten as far as we are today. So it's been really important. And I know quite often people who use substances have this kind of them and us attitude. And I got that right from the beginning when I started my work. It was like them and us. And I was like, no, if we can form allyship relationships with people and we have autonomy in the work that we do and we're allowed to influence and make those decisions on our own, then that is really just helps us in what we want to do. And I think it's really important to recognize that there are people in other positions, service provider positions and other positions that can actually help us move forward a lot more quickly and feel supported when we feel self-defeated, especially when we're talking about, just in our small community from a municipal level of, the ignorance and the lack of knowledge around harm reduction and actually opposing the work that we're trying to do. To have these support systems is amazing. So hopefully I answered the question.
Yes, absolutely. Thanks, Charlene. I'm going to turn it back over to you, Shane and Paige, because you've spoken quite a bit about your partnership. Can you give us a little bit more of a sense of how it's evolved over time and some of the challenges that you encountered?
I think the first thing that came to my mind is the power dynamic, what Shane was saying. I'm not sure if people fully realize how difficult that is. I know, so SOLID and Navy, I've had a really strong relationship for many years, a decade now. And so when, just in the last 2 years, so personally, I've been using substances for about 15 years. And so even in this very tiny city, I would be getting crack pipes from Shane, from his partners, from his wife. I was an active user in the community. And then all of a sudden, I got sober, and I didn't know how to talk, and I didn't know how to communicate. I didn't know how to be a person, honestly. I couldn't talk. I couldn't be in a room for more than 15 minutes without a panic attack or smoke. I just wasn't verbalizing things. So having someone like Shane and Mark and other facilitators who were able to listen and give us education. Education is power. Training is power, and that's what helps support us. But then there's this power dynamic, right? Because we've got this facilitator who's growing us from our lowest ability to capacity building. So now all of a sudden you've gone from this to this, and that's really, really difficult, and not just for Shane, but for his coworkers as well. Because when we would give him feedback as a group, his coworkers would say, "What the hell?" You're listening to Paige. You're listening to Paige, Billy, and Joe. Are you serious? Are you for real? What? No, you tell them what to do. Okay? This is great, and blah 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 blah. Because it's worked perfectly for 10 years. So why are you going to change it? Give her $15, maybe she'll shut up. You know what I mean? And like our relationship almost broke at one point. It really, and not just like us as friends or working relationship, but our organization almost tore apart for good. And we had such a strong relationship just over power sharing. I kind of think the Japanese people, when they break pottery, if they want to put it back together, they use gold, real gold, and the gold fills in those cracks, and it creates the most like unique, beautiful piece of pottery that you've ever seen. And that's sort of how I see our relationship and how it's built over time. We were so strong, this really functional, great pottery piece of cup, and now we got crumbled. And now we're just this really cool, unique organization because we held on, and it was really, really, really difficult. Tears, crying, anger, fights. It took a long time to work through it, to be okay with it. And not only on Shane's part, because Shane got a lot of, like he said, it was personal growth, but then his coworkers, the people around him, he had to defend us, the drug users, when he was still trying to grow as a person. So that was incredibly difficult, but then it was really like shaking, making you want to pee your pants at the table, trying to stand up for what you want when that's my leader. That's someone that I've looked up to for so long. I mean, like I look up to them, and now I'm having to challenge it. And it was really, really terrifying for both of us. It was a scary experience, and it took a little while. But like we're stronger than ever now, and we're able to work through things and challenge things. So I'd say like it's been a really positive experience, but very difficult. Worth it. It's true.
Yeah, it was really hard. There became a point where, as Paige said, like for years, things had kind of been plodding along and kind of growing, and then there was this like whoosh, this like growth shift, this like huge, like overdose crisis came, and everyone fucking pulled their pants up and did it, right? Like, and so the ground shifted kind of under me, and I didn't have the perception to see it. Like I didn't realize that I was no longer in a room of peers to each other. We were all peers now, and I didn't have the wits to see it, frankly. So I kept acting as if I had the authority to make decisions, which I had, but that was not where we were anymore, and I kept hitting that wall. I kept being like, what is going on? Why? What's going on? Like, and lots of tears, and just like, when you love people, like you want to be in harmony with them, right? Like you want to figure it out. It sucked, but it's also beautiful. I never heard you make the pottery analogy before, so that's great. And like honestly, like that, like having people say, no, you're worth it, and you got to change is like the most powerful gift you can be given.
Yeah, it sounds incredible and important work, very transformative. I'm going to shift the last question over to you, Sally. In terms of communicating the value of this work, because sometimes relationships are a little bit hard to quantify. What does evaluation look like for peer engagement and empowerment? And how has the CIE project tackled the task of monitoring and reporting on outcomes?
Yeah, it has been very challenging. I just want to start by saying, like, thank you so much to the four of you. It's beautiful. I love it. Thank you. It's inspirational. And so I guess I touched a little bit on our sort of evaluation approach. So our evaluation is really informed almost entirely by the people that we work with. So the things that we report on are the things that are important to the people that we work with. And the way we approach reporting, so we're lucky in that we're not bound by a lot of reporting requirements from our funders. So we meet those in a sort of feed the beast kind of way, like here's some numbers, here's what you need to know, that's all good, and so it just keeps rolling along. But what's really important to us is the learning that comes out of it. So the things that we're learning about how to best support this work, and we actively engage in these cycles of learning. So we take what we're learning and we feed it back into how we're planning our work. It's very intentional that we do it that way, so that things aren't just sort of passing us by and then we're not really paying attention to it. There have been some very real challenges, though, staying connected to peers and communities across the province. So for anyone who's ever worked with peers, you'll know that it's not that easy to stay in touch with peers. It's not that easy to just shoot off an email to peers. You know, a lot of them don't have email. A lot of them don't have a phone. They may have a phone for a while and then they don't have a phone. So there have been some real challenges, and there have been some connections that we haven't been able to maintain. We also started with the idea that we could maybe stay connected to one or two peers in a community, and they could sort of help us stay connected to the community. And that was challenging because it put a lot of pressure on, you know, one or two people, and it didn't always work out very well, because they may or may not, you know, stay connected to the peer community. They may or may not always be accessible, and so we didn't want to sort of perpetuate any harms by making peers feel overly pressured by that need to stay connected. So we sort of opened it up to, you know, let's try and stay connected with all the peers that we can stay connected with. And then that has challenges too, right? Because we have 144 peers that we're trying to work with across the province in many, many, many different settings. So there have definitely been some challenges there, but when we have been able to stay connected and we have been able to continue the dialogue, I honestly think one of the real successes is that we've been able to continually bring the peer voice back into our planning. Like, it is really, really important to us what peers are telling us and what peers are telling us in their communities. Yeah, we're working on a few other ideas of how to report that out to sort of wider audiences, because I think there is more interest in this now than when we started 4 years ago. So, you know, we're looking at ways to share what we're learning with as many people as we can, and also look at different ways to share it rather than sort of just writing reports and things like that, which is something that, you know, I was trained to do, and that comes pretty naturally to me, but that's not really useful for a lot of people. So we're trying to get a little bit more creative about how we can share learning with people. Mm-hmm.
Great, thank you, Sally. So that kind of concludes our panel discussion. We have lots of time for audience questions. So if you have a question for any one of the panelists, please just write it into the question field on your panel to the right, and then I will read it out to them. If your question is for somebody in particular, please just use their name so that I know. To get us jump started, I have CMHA's Senior Director of Policy Planning and Government Relations, Kendra Milne, in the room with us, and she has a couple questions. Kendra, what would you like to ask?
Sure, thanks so much. I think this is for everyone, but it came out, I mean, a number of you have made comments about the kind of importance of democratic control and autonomy in peer groups and the way they're able to inform service provision or activities that they're working on. And I really heard that, but it also made me wonder, because incorporating peers into services, as I think someone said, a bit of the flavor of the month, if there's any other kind of practical starting points maybe you would suggest for organizations that are wanting to do that work beyond the looking for a local peer group instead of kind of the more kind of tokenistic representation, especially around some of the work that Shane mentioned around kind of reframing your thoughts on power and who has expertise in the room and who doesn't have expertise. So I don't know if I'm not sure who to direct it to, but I'm just interested in anyone's thoughts on that.
A big thing that we've noticed down here and something that we always practice is we don't have one peer representing ever. So we always come in partners. There's always two of us here. It's not just one voice at the table. Even if I'm constantly reporting back to my peers and to different organizations, it's not just my voice, and there's always someone else to be heard. So I think that's really important when you're learning to share power, because one peer is not always right or has all of the information.
And I think perhaps I was a little, like, my comments were not particularly trusting, in so much as I do believe that people can unlearn dynamics that are steeped in power. Like, I know we have all done that. I really feel strongly that people can do that. So an organization that wants to work dually and democratically with peers may not start with the ability to have a separate organization with its own funding, and it's, you know, like, that may not be where you start from. But I think certainly there needs to be some real soul searching and some work on the part of that host organization to really unpack some of the expectations of people, how you're going to actually share what's possible, what's the path that you want to follow. Like, I think, and you do that together. Like, you figure out, and to have a bit of those tough conversations with, like, yeah, when you do this, it makes me feel crappy, and I'd like that. So how do we change that? I think that's, like, if you're going to seek to, like, grow to the point of having a sense of independence, but you need to map that process out, and that's going to require some reflection. People are going to have to, like, talk and reflect and do some real, read some good books. Like, I mean, you're going to have to get kind of in there, maybe go to counseling. I don't know, whatever you got to do, and kind of dig some of that stuff out so that you can actually be, like, eye to eye, because we are full of stigma and we are full of bias that isn't our fault. Like, we actually didn't, like, we inherited it, right? So we are responsible for, you know, tossing that stuff, right? Like, and that's, anyone who has kids knows that, right? Like how much am I going to pass on to, you know, my kids, and they're going to get a lot, but hopefully I can, you know, shorten that down, right? I think it's a very similar kind of thing, right? Like, that, what I'm past, I want to eliminate as much garbage as possible, and that's gonna like require some real truth telling and like reflective thinking. Right?
Yeah, Charlene here. I love that. Thank you so much, Shane, because that's the sentiments that I was thinking. But I think it's really important for people when they're engaging peers to really recognize their power and privilege. And quite often people don't recognize the power and privilege that they hold, even as a service provider or a peer who maybe have been doing this work a lot longer than others. Recognizing who you are and where you come from. And when you talk about power and privilege, people really have a hard time sometimes self-reflecting on their own power and privilege. You know, the fact that you may have a home, you know, the simplest things that create an imbalance between a relationship of engagement are things that you really need to take into consideration. And so I just suggest that. And I think that, once again, best practices has a lot of stuff in it that really starts to get you thinking. But thank you so much, Shane, for what you say, because it's really important for us to recognize that we do carry bias. I came into this work with many of them myself, and I wasn't born with them. They were taught to me. So you really got to ask yourself, why am I responding the way I'm responding? And is this about me and my thought pattern, or is it about the current situation and what I'm engaged in? Thank you.
Yeah. And I'll echo as well what Shane said, because I think that I've spoken about this a lot recently, and it's something that I think about all the time, that we as organizations, right from the very top down to, for myself, when I'm, you know, sitting with a staff person, we got to unpack our own stuff that we're carrying into this. And I know when I reflect on, you know, years ago when we were entering this public health emergency, and the people we were working with, the population was really changing, and what we were all facing was really, really changing, and we had to change with it. And that meant a lot of times stepping out of our comfort zone, like really being reflective around where our approaches were coming from. We had some punitive approaches that we really had to examine and go, where is this coming from, right? And we had to challenge ourselves, and we had to grow as an organization and as individuals. We had to educate ourselves, and it was really about stepping out of our comfort zone and looking at those biases that we are all coming to the table with. And we're really fortunate, or I'm really fortunate, to work for an organization with a board of directors that is so supportive of that work, right? We're not caught up in bureaucratic red tape or anything like that. We get to be creative. We get to work outside the box and do what's right. And so, yeah, I guess that's my answer to the question, is that I'm constantly, when I'm speaking to nursing students, when I'm engaged with staff, and you know, whenever I'm in conversation, I'm talking about that, challenging our perceptions, and that's what needs to happen across the board now, I think.
And I can sort of speak a little bit also to that idea of sort of humility and self-reflection when it comes to thinking about sort of peer engagement on a systems level, like the sort of whole healthcare system and the overdose response and the sort of provincial, you know, apparatus that's now been created. You know, it can be easy when you're in a crisis situation, and I think Charlene was saying earlier a little bit, like, people come to this work with good intentions, but sometimes you can sort of come in with the good intention of just really wanting to fix it now and make it better now and make it all stop. And you know, and you do have to sort of keep pulling back and going, okay, well, are we listening? Are we really listening to what peers are telling us? Are we really listening to what communities need? I mean, because this work of sort of collaborative dialogue and peer engagement, you can't force it. You can't make folks sit down together. You have to really listen to their concerns and then find ways to support that. And sometimes that isn't on the timeline that you think it's going to be, and sometimes it looks very different than what you thought it would look like in the first place, and you just have to keep being in that listening space, and then sort of turning it around a little bit. Shane and Mel, I was thinking, you know, sort of using that power and privilege that you might have and take that back to the system in a position of advocacy, right? Like when you are in a position that you can use it, right? In a positive way. Yeah.
Thanks, Ellie. That actually leads really nicely into one of the attendee questions. They're interested in knowing how to shape policy based on your learnings working within peer partnerships. I'll leave that open to whoever has thoughts.
Here it comes.
So the only experience that we have with that recently is when we're working with the healthcare system, because we're really, really, really fortunate in BC that we're the only province that has a harm reduction policy that has to be followed in hospitals. But what does that mean? How do people have to follow it? Well, there's this actually huge gap. Yes, it's a policy, but there's no way to put that policy into action. That's the problem. So what we've had to do is we've had to reach out to the College of Physicians and Surgeons. We have to reach out to our research partners and say, here's the gap. You created the solution, so how do we bridge that? And And so we're still in the midst of trying to make that work, but we've definitely had a lot of communication and a lot of people reaching out to try and figure out how to make that standard and make it work.
Yeah, I'd just like to mention, I think part of the problem is that policy is part of the problem, not the solution necessarily. Quite often, certainly from, if we're talking, top up the policy around substances within our nation, period. But I think it's important to recognize sometimes that although there are policies and mandates within certain organizations, health authorities, et cetera, that quite often outside of large urban centers, there's still these bias that actually influence the lack of services that are being implemented, the life-saving services. I think that if you take a really good hard look at the disproportionate amount of overdose deaths in small rural communities and the lack of services and the accountability to the health authority to be providing those services is actually quite astounding, very problematic, and troubling.
Thanks, Charlene. Thanks, Paige. Kendra has a quick follow-up question.
Yeah, I think it was Melanie who mentioned sort of in your community working to make sure that you communicate and have media coverage and photographs and things like that of peers doing their work to kind of battle some of those super deeply ingrained discriminatory biases. I wonder if any of you can speak to whether or not you've seen a change, like in conversations at your local government or with local police or in your communities as a result of some of these conversations and some of this work being done.
I think we've seen small shifts. They're small. They're not as big as they need to be, but we have seen some small shifts. And certainly there's been some really positive things that have come out of some of the media work we've done. Like our clean team, they're constantly reporting, that people are honking and waving and so thrilled to see them out there in the community. Our clean team peers as well they're engaging with different businesses in the community. They've gone and done take-home naloxone training with business owners who have wanted that, with organizations in the community. So peers are building relationships and changing perceptions on the ground, and that's happening. And certainly, things have quieted down since last year when we had a lot of public uproar around our housing and moving our shelter facility and all the mess that came with that. So things have quieted down and on our municipal level and with some of that leadership, some of those statements, those inaccurate statements that were helping to drive stigma in our community, that has definitely quieted down. And I don't know if there's an internal shift there. I wouldn't say that, but it's not quite as ugly as it was a year ago. But so I do think that some of that media, I do think that the media has helped. It's definitely helped bring awareness around our overdose crisis in our community. I still get people who say to me, oh, I didn't think that that was happening here or that we were impacted, right? And so I think a lot of people kind of go through life blindly and miss, some of the human rights issues that are happening right in our own community. So I do think it's shifted. Awareness is growing. The media helps. Media helps, especially social media, if you can use it as a tool.
I have a little bit I'd like to say about that. I think it's important to recognize that CSUN is working directly with the newspaper now to do kind of an opportunity to share knowledge within the community. I think our community readiness is at an all-time low. We have amazing people who are champions in the work that we're doing, but there's just a lack of education and understanding within the community. So CSUN is taking on this role, and we do it in every opportunity we can. But I think it's really important to mention that peers still themselves have these own ideologies about themselves and that they're bad people because they use drugs. Peer engagement in outside of Vancouver and the island, and the amazing work that's been going on for many years there, this has not been happening here. I still have drug users, people who are using drugs in my community who think that they are horrible, nasty people and they have no right to anything, and that they get what they deserve because they've been told that for so long, and because they themselves thought that, and once they start using substances themselves, they put themselves in those. So there's so much work to be done about supporting people who use substances to realizing that they have rights and that they can be engaged in this work. And I think it's so that it's not just the public themselves, it's the actual people who are substance users who believe these horrible things about themselves. And so there's so much more work to be done, outside of the Vancouver area, from my perspective, and certainly in the work that I do with CIE. I think it's really important that we recognize how important it is for us to empower each other as substance users, past or present, to understand that we have value and that we should be part of these systems in which we access.
Thank you, Charlene, and that's a really powerful way for us to end the webinar. We're coming up on the 1:30 mark. I want to thank our panelists again and everybody who joined the webinar. Our apologies for the technical difficulties. A few quick mentions before you sign off. You'll find CMHA's policy paper on the opioid crisis in the handout section on your panel. If you're interested in learning more about CMHA's recommendations for a comprehensive approach to harm reduction and treatment, I encourage you to download a copy. There will also be a short survey in a pop-up window when the webinar concludes. We greatly appreciate if you take a minute or two and fill out the survey. Your feedback will help us design future policy webinars. Thank you again. Enjoy the rest of your day.